I will now be handing it over to Aura Aparicio, who's a project coordinator for the Cross-Bay Center of Excellence for Immigrant Child Health and Wellbeing at UCSF Benioff Children's Hospitals. She'll be sharing some information about the Center of Excellence and introduce you to our presenters for today. We're very grateful and appreciative of this partnership with Center of Excellence in collaboration with all our panelists for today. Thank you, Aura, for being here with us today.
Wonderful. Thank you so much for the introduction. Once again, I'm Aura Aparicio with the Center of Excellence for Immigrant Child Health and Wellbeing at UCSF Benioff Children's Hospitals. We are a cross-bay center whose mission is to establish an inclusive community that provides leadership and guidance towards the promotion of optimal health and well-being of immigrant children. The work of our center sits on 3 pillars: clinical services, education, and advocacy. And among various initiatives, we coordinate and lead a pediatric asylum clinic, providing medical and psychological forensic exams to support children and youth petitioning for asylum. In addition, we're also training the next generation of providers, medical students, and medical residents with an immigrant-focused lens. And we, this is a bit of a love fest here. We are grateful to be partnering once again with First 5 Alameda County to offer these events. And it is my pleasure to introduce today's panelists. They are service providers. They are experts in the field. They have wonderful bios. I'm actually, in lieu of time, I'm going to go ahead and put their extended bios in the chat. But I am happy to introduce Ana Rodriguez, Immigration Senior Know Your Rights Coordinator from Centro Legal de la Raza, who will open up for us. Benjamin Chow, Health and Public Benefits Policy Analyst from the California Immigrant Policy Center. Michael Moniz, Program Specialist from San Francisco Human Services Agency. And Alejandra Plata Zuniga, Lead Navigator and Community Health Worker, Find Connect Program at UCSF Benioff Children's Hospitals. So I am going to pass this over to Ana. Welcome and thank you so much for joining us.
Thank you, Aura. I appreciate it. Good morning, everyone. Thank you all for being here today. I hope my presentation is informative for you all and helpful. And with that, I'll go ahead and get started. Again, I'm Ana, I'm coming from Centro Legal de la Raza. We are, sorry, I'm getting used to the controls. We are an organization that was founded in 1969. So we've been around the Fruitville community for around 54 years, going on 55. We provide legal services to low-income people living in the Bay Area and Central Valley. All our services are free. What we actually do, we provide legal services in 3 different parts. So we do immigrant rights, tenants' rights for those living in Oakland, Hayward, and workers' rights. In terms of immigration, we do an array of cases such as asylum, U visa, T visa, SIGIS, DACA, VAWA, etc. Hopping into the good stuff, public benefits. So as most of us probably know, public benefits provide folks much needed help, whether it be through food stamps, housing, Medi-Cal, among other many different public benefits. They are something that definitely help a lot of undocumented folks as long as they're able to meet the requirements and apply. Due to this, when receiving public benefits, this can be taken into account in someone's immigration process, more specifically when they're applying for residency. That's usually when it could potentially fall under something called public charge. So public charge has been around since 1882, and since then it's really only taken into account cash assistance and long-term care. So obviously that leaves out a lot of different public benefits that a lot of people still use. However, when Trump went into office, he threatened to change that. And what he wanted to do was add the following: nutritional support, income support, housing assistance, and health. And under health, obviously we had Medi-Cal for adults. So in him trying to add so many more public benefits, which also included that if a person was receiving one or more public benefits for more than 12 months in the aggregate period of 36 months, being if I receive two public benefits in 1 month, that would count as having received public benefits for 2 months. Obviously, it was a very confusing time. Even I had struggled to like properly understand what was happening with this new proposed public charge ruling. So if I was struggling, this obviously caused a mass panic and confusion amongst the undocumented community, trying to grasp what was changing, and this led them to take precautionary measures for them, which meant that they were either opting out of receiving public benefits because they were unsure of whether it was going to negatively affect their immigration case or potential immigration case down the line. Um, and not only that, they were also just, if they had the public benefit, they were canceling those public benefits. So for example, people's health started to decrease because they would stop going to the doctors or would only go as a last resort just because they didn't want to tap into these public benefits out of this fear. Now, Medi-Cal and public charge. So the original public charge, as we saw, only consisted of cash assistance and long-term care. So it did not include Medi-Cal. But the proposed new rule that caused this confusion would include Medi-Cal for adults, but not for children and pregnant women. The proposed public charge changes, thankfully, while they went into effect at one point, they eventually got reverted back to its original standing. However, it has had lingering effects because people were and definitely still are afraid to apply or receive public benefits like Medi-Cal. It's kind of like one of those I don't want to risk it situations. However, Medi-Cal and the immigration rule is a great thing. Um, and that's why we consider this to be a win for the undocumented community when we had the expansion of Medi-Cal, that would allow adults to qualify for full scope Medi-Cal, not only emergency Medi-Cal, regardless of someone's immigration status. And fun fact, it also includes dental. So that's also pretty big news for us, right? So for someone who's applying for some form of immigration relief, having Medi-Cal can definitely help since many immigration cases often come with fees. I'm talking about hundreds of dollars in fees, sometimes close to like 500. And obviously we know that um, it's hard to come across these funds sometimes, and it can delay someone being able to apply sooner because they have to wait for them to acquire this money and things like that. So obviously it can be a burden. Thankfully, some of these applications do come with with fee waivers as long as someone can prove that they're low income. So when applying for these fee waivers, folks need to show this proof, and one of those being Medi-Cal. So now we're hopeful that there's going to be more people being able to qualify for these fee waivers and having to avoid paying these large fees for their immigration process. Ways in which we try to help. So as folks might know, um, coming across an attorney who has a capacity to take on new cases is difficult. Nevertheless, we definitely still try to provide folks with resource lists, especially referrals to different attorneys in the Bay Area that are trusted, that are low income, affordable, and then obviously fingers crossed that they have the capacity to take on new cases. And when it's outside of our scope of practice, I personally default a lot to La Clínica de la Raza, just because they're actually in the medical field and have stronger ties to the medical offices whenever someone comes and approaches me with something a little bit more medical. We try to reassure undocumented folks through Know Your Rights presentations, not only that they have rights as undocumented folks here, but that many public benefits do not actually impact those applying for humanitarian-based relief, which is actually very big in the undocumented community. Like a lot of times, this is what most people are applying for. For example, asylum, U visa, T visa, VAWA, SIGIS. In all those types of immigration cases, you could be receiving all the public benefits available to you, and that wouldn't be taken into account for public charge down the line because of the type of immigration case it is. Nevertheless, we still remind folks that it is always best to talk to an attorney before starting or ending public benefits, just to make sure. Every case can be a little different. So we want to make sure that they're getting the best advice possible. And I'm personally a big advocate of at least having a legal consultation, whether it be public benefits related or legal questions. Who best to ask those, and to an attorney that can give you the proper and correct answers. And then lastly, we hope for folks not to jump to conclusions. We don't want folks to self-assess. I feel like that's something that I see a lot in the community, where this goes again with like opting out or into public benefits, for example, where instead of having a consultation, they'll just be like, you know what, I don't want to risk it. I'm not gonna apply for these public benefits, or I'm gonna stop receiving these public benefits because I think maybe down the line it can affect me. Let's not self-assess. Let's get those clear answers. Let's get a consultation and ask those answers to an attorney that can properly tell you yes or no, right? Many people refrain from applying for public benefits out of fear that it could affect them in the future for public charge, as I said. Others decide to opt out of public benefits that they were already receiving because they fear that it could negatively impact them on their immigration case. Again, not something we advocate for. We definitely want folks to receive the help that they need. And that's why before folks decide to opt out of something they're already receiving, it's best for them to talk to an attorney to make sure that it actually probably isn't affecting them based on the immigration case that they probably have. And then, like I said, more often than not, it won't affect them. So, a long story short, my takeaway here is public charge was a very confusing time when a new rule was proposed. However, reminding folks that a lot of the times public benefits actually won't affect you based on your immigration case. But let's talk to an attorney first. And at the end of the day, receive the help that you need to receive if it's going to help you and your family out. Thank you.
Thank you so much, Anna. We are going to, I don't know if there was anything in the chats, Catherine. If not, then we can go ahead and.
There were.
Yes, there's a couple of questions in the chat. We
Do you
do
want
have
them to go right now?
Well, I think there's only two.
Sure. Besides Medi-Cal, what are the other public benefits that undocumented people can apply for?
So I mean, I based on my knowledge, it usually depends on where you're at with your immigration case. But like food stamps, and then also just that's the first one I think of. I'd have to get back to you on more of those, but I think it's also just looking at what the requirements are, as long as it's not asking for like immigration status and stuff like that. But yeah, I'd have to get back to folks on that. And then Benjamin will go over some of those programs. Thank you. And then the other question was any sense of how humanitarian immigration cases might change under a Trump administration in regards to public benefits and public charge. Honestly, I think the immigration folks are a little scared if Trump does go into office. And then in terms of this, I think he might try to bring back his proposed public charge ruling. So it'd be a matter of seeing what if he's bringing it back the same, if he's changing something, adding something. So we are definitely a bit afraid of what could happen under Trump just because of how anti-immigrant he is. So
Wonderful. Thank you so much, Anna. We will pass it on over to Benjamin Chow, Health and Public Benefits Policy Analyst from the California Immigrant Policy Center. Welcome, Benjamin.
Hi, everyone. Good morning. Can you hear me?
Yes.
Great. Okay, I'm going to share my presentation. Uh, okay, so good morning. Thank you everyone for being here, and really excited to talk today about public charge to add on to what Anna shared, and also just the various safety net programs that immigrant families might be eligible for, and whether or not they interact with public charge. So yeah, a little bit about my organization. I work at the California Immigrant Policy Center. We are a constituent-based statewide immigrant rights organization that's based in Los Angeles and also has an office in Sacramento. I'm based in our Sacramento office, and we largely advance for policies that uphold the humanity of immigrants and refugees and advancing racial, social, and economic justice for our communities. So a lot of our time is spent on things like, the work to expand the Medi-Cal program to undocumented community. But over the past couple of years, with concerns over public charge, that's also been something we've worked on. We also convene the California Protecting Immigrant Families Coalition, which is a coalition of direct service providers, advocates, immigrant rights leaders, that work to address that chilling effect that was created through public charge, and also just the larger climate of fear that affects our communities when they interact with the government or social services. So a little bit about protecting immigrant families. We're actually part of a larger national coalition called PIF. We're just the California affiliate. And yeah, we are a large organization comprised of all these different types of advocates and stakeholders that united to defend against the public charge rule when Trump was in office. And now that the Trump public charge rule has been reversed and there's a new Biden rule, the work has shifted to educate our community and also advocate with state and federal agencies to do more to communicate to immigrants that these benefits are available for them, and also make the process easier for them to enroll. So we've talked a lot about public charge. I'm just going to go over what the definition is again. Public charge is a grounds of inadmissibility that comes up when people apply to adjust their status, and it refers to a person who is considered likely to become primarily dependent on the government for support. So when Trump was in office, he was trying to change the definition so that if you were enrolled in all those various non-cash benefits, that would automatically make you considered a public charge. That is no longer the case. And the public charge test looks at many factors besides your receipt of public benefits. It looks at your age, your household composition, your income, and that's called the totality of circumstances test. So even if there is a benefit that does fall under consideration for public charge, like cash benefits, just want to remind folks that that doesn't automatically mean someone will be considered a public charge. There's a bunch of other circumstances that come into play, and we recommend people in those situations get legal advice. Another federal policy that affects eligibility is the 5-year bar. And this was established in the late 90s. So it's a 5-year waiting period for otherwise eligible legally present immigrants to become eligible for safety net services. So this primarily affects Medi-Cal, Medicaid, and SNAP. Fortunately, in California, we have reversed the 5-year bar, so applicants in our state aren't affected by this, but folks in other states might have to wait for a 5-year waiting period. And advocates on the federal level have been trying to change this for a while. So if you're interested in that, you can look up the Lift the Bar Act, and that's what people are doing on the national level. Yeah, as Anna mentioned, there's a long history with the public charge rule, and it really came into our attention when he became president. And in 2019, his final rule, he proposed a final rule that was harmful and racist and xenophobic. But you know, in 2020, it went into effect. But when Biden became president, he reversed that regulation, and in 2022 actually changed the regulation so that you know, if Trump wins office again, he will have to go through more steps to implement a harsh public charge rule. So the new Biden rule, which we call it, went into effect at the end of 2022. Which means that it is safe for immigrant communities to apply for many of the benefits they're eligible for. But unfortunately, there's a lot of work that still needs to be done. It's been it's been over a year that this rule was in effect, and a lot of families don't know about it, and there's still a lot of misinformation out there. So that's where our work is communicating to families about this new public charge policy and empowering them to make the decision to enroll in benefits. Just to really outline what this lingering effect is and how it continues to harm families. There's a study that was published at the end of last year that found that across the country, 1 in 6 adults in immigrant families with children decided to avoid safety net programs because of concerns with their green card. And this has affected an estimated 3 to 4 million children in those families. And these are families that are low income and, you know, might be experiencing a lot of hardship. And so this is really concerning, especially if they are eligible for these programs and are just avoiding it because of fear. With our partners, we've actually done some message testing to find out, you know, from focus groups, what is effective in getting people to change their mind. And we found that the most important thing is to remind them about their right to use these benefits and the responsibility of the government to help them in their time of need. When having conversations with families, some things that have helped is to try to mitigate that stigma. You know, in addition to the fear of getting punished for using these benefits, there's just a broader stigma about, you know, getting help and using these programs. So what we like to do is emphasize that, you know, our community members, they're working, they're paying taxes, they're contributing into the system for the benefits that they're eligible for, and really remind them of the benefit of these programs. So if they are struggling with paying their bills or affording their grocery bills, really remind them of what these benefits will enable them to do. So if they apply for a EBT card, it will provide them with short-term help that will help their family in the long term. And you know, as people who work in policy, I think we really get stuck in the weeds of, you know, there's the 2019 public charge rule, there's a 2022 public charge rule. Our community members aren't as invested in learning about these policies, but they do know about, you know, us having a new president since 2020. So it is also helpful to reference that there is a Trump rule and there is a Biden rule, and that helps people track that a change did happen. But it's, you know, it's also important to avoid politicizing it too much, so we can keep the conversation focused on the benefits and enrollment. Just one thing I wanted to share with you all is that we've done a lot of work with the California Health and Human Services Agency, which oversees the Department of Healthcare Services, the Department of Social Services, which administer these benefits. And they released a new public charge guide, which you can find on their website. And the top line message aligns with what advocates are trying to say, which is that immigrants can now access healthcare, food, and housing support, and many more public benefits without fear of immigration consequences. in our message testing, we found it's really helpful to show people information that has a government logo on it or is delivered from a government official. It makes it much easier for people to trust the information that they're receiving. And so, yeah, I recommend people check this out if you want language to communicate to your community members. And the guide is available in 21 different languages spoken by residents of the state. Great, so I'm going to move on to talk more about the benefits that families may be eligible for. Our coalition has produced this toolkit, which is called the ABCs of Immigrant Health, which we use to communicate to immigrants on how they can navigate this complex web of public programs. The first letter we tell them is A for advocate. I really like this one because when we think about the Medi-Cal expansion, that was a result of immigrant leaders advocating for their own health and for their family. So we really want to empower our community members to know that they can ask for help and ask questions and learn and educate themselves and take action. And we hope that enrollment assisters, can do the same for them. B, communicating the benefit of signing up for services and reminding them that there are services that are safe to use, and some of them are eligible for regardless of their immigration status. And C is confirm. So I'll be sharing a tool at the end on how people can confirm their legal right to these services and find out what services they can use without consequences. Great. So I think a lot of us here work with children. One stat that I remind myself of is that 1 in 2 children in California are a part of an immigrant family. So even if the child themselves is has legal status, maybe their parents don't, and that tends to be a tricky situation because family members, they may be afraid of applying for their household because one of their family members is adjusting their status or lacks legal status. Yeah, if you're in a mixed status family, it's important to know that if your child is eligible for health, housing, or nutrition benefits, their enrollment in those services will not impact someone else's application in the household. So the types of benefits range from health services like Medi-Cal to food and nutrition access like SNAP, free school meals, WIC, and childcare, or even economic support like different tax credits that the family might be eligible for if they have children in their household. This is just an overview of different health programs that immigrant community members may apply for depending on their income level or immigration status. The one that I'll be focusing on is Medi-Cal because as of this year, all Californians who are income eligible can receive full scope Medi-Cal. That went into effect January of this year. And that's the program that we're really trying to get people to enroll in right now. I'll just note that immigrants may qualify for Covered California, but it currently excludes undocumented immigrants and DACA recipients. But there is work underway to launch a campaign that would create a way for undocumented Californians to access the affordable, the Covered California marketplace. Great, so using Medi-Cal won't affect someone's immigration status unless it pays for long-term institutional care. That may include, being institutionalized in a mental health facility long-term or a nursing facility. But other ways of using Medi-Cal like COVID testing, preventative care, will not affect someone's immigration status. Also using county-funded healthcare programs. I know like in LA, we have like My Health LA. That won't affect someone's immigration status either. And I think some folks on this call might go more in detail about Medi-Cal, so I'll just move us along. Great, so as I mentioned, Medi-Cal has now expanded, so anyone can apply. An immigration status doesn't matter. And so this is just an example of the new, marketing materials that the state has put out to help get the word out. Great, and I just wanted to play this video to just get the message across on and how the state is communicating to families about this expansion. Let's see if I can get this to work.
More Californians can now get free or low-cost Medi-Cal, and immigration status doesn't matter. Full Medi-Cal covers healthcare services to keep you healthy. Applying for or using Medi-Cal will not affect your immigration status. Learn more and find out about free in-person help at medical.dhcs.ca.gov.
And yeah, when I started on this work for the Health for All campaign, I used to be undocumented myself, and so it's just really important for community that we were the first state to make this expansion possible, and we're seeing other states work towards this and making their healthcare programs more inclusive.
More Californians can.
Just moving on to food and nutrition services very quickly. Earlier, someone asked what other benefits folks may be eligible for, and one of the programs named was CalFresh, otherwise known as SNAP or food stamps. Unfortunately, as of now, CalFresh is not available to undocumented Californians, though there are efforts to change that. And we actually have an expansion for CalFresh scheduled for October 2025 for people over the age of 55, or people who are age 55 and older. So hopefully soon we can say that all Californians can apply for CalFresh, but right now that is not the case. But very soon we're going to have our older population be included. But other programs that undocumented Californians can apply for are school breakfast and lunch, pandemic EBT and summer EBT, if their children are enrolled in a school that qualifies for free school and lunch, WIC for women, infants, and children, and also food banks don't discriminate based off their immigration status. So if you want more information on CalFresh, encourage folks to visit getcalfresh.org. And as I mentioned, due to the work of the Food for All campaign, California is committed to expanding CalFresh food benefits to all California residents age 55 and older, regardless of their status, and that's scheduled to go into effect October 2025. Other benefits that immigrants may be eligible for are economic impact payments. So, during COVID, we had stimulus checks, the Earned Income Child Tax Credit, workers' compensation, student loans, financial aid, unemployment insurance. Unemployment insurance, undocumented Californians aren't eligible for, but immigrants with varying status may be eligible for unemployment insurance or emergency rental assistance. And so all of these types of economic support will not affect someone's immigration status. And other programs that won't affect someone's immigration status include public education or childcare, preschool like Head Start, veterans benefits, emergency and disaster relief. That's something that's more and more important now with fires and storms in our state. Section 8 housing, and more. So in short, yeah, there are only two types of benefits that are considered for public charge. It's public cash assistance. So if the benefit is coming in the form of dollars that they can use on anything, then it will be considered for public charge. So that includes supplemental security income, temporary assistance for needy families, or CalWorks, cash assistance program for immigrants, or general assistance, and long-term institutional care paid for by Medicaid, but that only counts long-term care such as a nursing home facility or a mental health institution. And so, yeah, as you speak with your community members and they seem interested or empowered to apply, one thing that you can do with them or they can do themselves is visit keepyourbenefits.org. This is a really helpful website that was developed in partnership with PIF and through the leadership of the San Mateo Legal Services Society. And when you go on the website, there's a guide, which is like an automatic quiz where it asks you, what is your immigration status? What programs do you want to apply for? And it will tell you whether or not you need to worry about public charge. And if you do need to consider public charge, there's a list of different service providers in California that you can contact. So that's the end of my presentation, and I'll pause there. But yeah, thank you so much. And I hope this information was helpful.
I think we have a couple of minutes for a couple of questions here. I think some are in the chat. Some may have been answered by Ben, but just wanted to make sure if there was anything else that you'd like to add to it.
Sure. Okay, so I see here, will changes for a new public charge rule affect an application retroactively? I'm assuming that's a question for if there's a new public charge rule, like if Trump gets into office. So we can't say for sure unless we see that new rule in writing, but with the Trump rule in 2019, it wasn't retroactive. So if I don't even want to imagine the scenario, but in the worst case scenario, there is Trump in office and he implements a new rule. If it's similar to the old rule, then it won't be retroactive. But I think that's something that we are going to be very vigilant about if we do get a new president. What if children born here but parents undocumented? Can they apply for CalFresh? Yes. So the children would be eligible for CalFresh if they are U.S. citizens. So the parents can apply for their children on their behalf. And we encourage them to do so because it won't affect their parents' immigration status. Can receiving housing assistance negatively impact an immigrant's pathway to permanent residency in the future, especially if they're undocumented? So undocumented immigrants don't qualify for federal housing assistance. But if you're a green card holder, you may. And in that case, you don't have to worry about public charge. But besides that, housing assistance isn't counted in the public charge test. So we encourage everyone to say that housing assistance is safe to use. There's more questions here. How about cash aid CalWorks? So as I mentioned, CalWorks is a form of cash aid. So it is counted in the public charge test. So we encourage folks, if they are applying for, if their household receives CalWorks and they're adjusting for a green card, the thing is, CalWorks isn't open to people who are undocumented. So this is a situation I don't think we'll find a lot of people in. But if it's a mixed status household and a child is eligible for CalWorks because of the children, that won't affect the parents' immigration status. I hope that answers your question. What SSI for a child with a disability will it affect a parent's case? So as I mentioned, a family member's use of public benefits won't affect that individual's use of public benefits. So if a child is receiving SSI due to their disability, that won't affect the parent's immigration case. Not sure if I missed this, but do Medi-Cal services also cover mental health services? To my knowledge, yes, but looks like Michael is going to tackle that in the next question. Great, I think that's the end of the questions.
I think that's a good segue right there. Thank you so much, Benjamin, for all the knowledge, for all of the resources. We will now pass it over to Michael Moniz, Program Specialist from San Francisco Human Services Agency. Welcome, Michael.
Good morning, all. Thank you so much for having me. Okay, could I just get a quick thumbs up? Is everyone seeing my screen correctly? Excellent. So just a quick background about myself. I'm really excited to be here today. January 1st, 2024 represents just the end of a long road of expanding the scope of Medi-Cal services to everyone. I've been with San Francisco for about 12 years now. And back when I started, it was limited. It was before the Affordable Care Act even. And so benefits were limited. You had to be aged, blind, or disabled, or had dependent children. So now fast forward to January 1st, 2024, and we're opening it to everyone. And the scope of coverage is increasing for everyone. So it's a really exciting time. I'll just head on here quickly. So as an overview, Senate Bill 184 amended WIC code to expand full scope Medi-Cal eligibility to individuals 26 to 47 who do not have satisfactory immigration status if otherwise eligible. This initiative, adult expansion, was modeled after Senate Bill 75 and the young adult expansion and the older adult expansion. And so Senate Bill 75 that went into effect in May 1st of 2016, and that gave full scope benefits to every child under the age of 19 in the state. And then for young adult expansion, that went live on January 1st, 2020, and that gave full scope benefits to young adults from 19 to 26 years old. And then for older adult expansion, that went live a couple of years ago, May 1st of 2022, and that gave full scope eligibility to adults 50 years of age and older, regardless of immigration status. And so today we have adult expansion, and that went live January 1st of 2024, and that gave full scope benefits to everyone between the ages of 27 to 49. So I'm talking about full scope versus restricted scope benefits, right? So undocumented immigrants or individuals lacking satisfactory immigration status, they've been eligible for Medi-Cal previously, but they were eligible for something called emergency only. And so that was basically limited to emergency room visits and some pregnancy benefits. So full scope benefits, that encompasses the entire continuum. So it encompasses eye care, dental care, preventative care, mental health care, and prescription drug benefits. So it's a really great expansion that will just give the whole breadth of services, make the whole breadth of services available to our clients. Moving on, so we have, again, this is modeled after a couple of different expansions that we've gone through before. And so those are usually broken down into two different populations. So we have the new enrollee population, and those are individuals who apply starting January 1st of 2024 and after. And the transition population, which I'll talk about in just a moment. So I just wanted to call out that when you apply for Medi-Cal, you can apply for up to 3 months of retroactive coverage. So if someone's applying today, then they could apply for retroactive coverage from December 2023 to February of 2024. Now, the only thing with that is that because the expansion went live on January 2024, if an individual is requesting retroactive benefits for December of 2023, then unfortunately they wouldn't be covered under they wouldn't be covered under the adult expansion just for that month. So they would still get full scope coverage for January and February, and of course for March, but we would have to give them restricted scope coverage for December of 2023. And then the other population that I was talking about is current Medi-Cal beneficiaries between the ages of 26 to 49, who are currently enrolled in or were previously enrolled in restricted scope Medi-Cal solely due to immigration status. And so these are individuals who, again, previous to January 1st of 2024, had restricted scope or emergency pregnancy only benefits, who are now being transitioned to full scope benefits so that they can choose a medical care provider. And again, we have the state and local impact here. So for the transition population only, the estimated expansion gave full scope access to an additional 1,113,000 Californians. And as I'm here in San Francisco, the transition population for San Francisco was about 11,513 that were previously eligible for that emergency only restricted scope Medi-Cal, but now have access to just full scope Medi-Cal, and they can access all of those services effective January 1st. And just to kind of give you an idea of kind of what changes and what stays the same. So even though we're giving full scope benefits to everyone, we're still going to have to ask for immigration status, immigration documentation, things like that, when the client applies. So we would give full scope benefits effective on their application date. And then we would give them about 90 days reasonable opportunity period to provide their immigration documents. Now, the good thing is that what changes, what changes is that if the client fails to provide their immigration status, they would not be reduced to restricted scope Medi-Cal. So they would continue on full scope Medi-Cal, even though they did not provide immigration documentation. So again, if you have a client that comes in and says, hey, I thought that we were getting full scope Medi-Cal, why are they asking for my immigration status? And the answer is basically the funding, right? So the adult expansion is from California only. It's using California funds. And so that's why we still have to ask, because if a client does have satisfactory immigration status, then their Medi-Cal will be funded through the federal government rather than through the state. So we do have to ask, but again, if the client fails to provide, then they would not be reduced to restricted scope. And then just to give you an idea of the transition process, again, like I said before, we've been through this a couple of times. So the first notice was sent out, and this was kind of a general notice and a FAQ, just informing clients that were enrolled in restricted scope Medi-Cal. And then we had the managed care enrollment notice that was sent in right around Thanksgiving of last year. And then around the same time, the computer system that we use initiated automated transition batches and sent a second notice. So the batch jobs were to effectuate full scope Medi-Cal effective January 1st. And then during the first week in December, DHCS, the California Department of Healthcare Services, processed transition batches. So again, back here in November, we had batch runs that went through our automated system to expand the scope into full scope, but it's a computer system. It doesn't work exactly right often. So In that case, DHCS basically, we call it online full scope aid codes effective January 1st for clients that did not successfully transition via batch. And then we have adult expansion, January 1st is available to all applicants and beneficiaries. And then starting February 1st of 2024, clients who did not enroll in a managed care plan by the due date are auto-enrolled into a managed care plan so that they can access all of those, that full scope benefits, prescription benefits, dental benefits, vision benefits, and all of that stuff. Moving along, we just have some, excuse me, some examples. So again, the first notice was just general information and a fact, just kind of informing clients that this is coming effective January. And then the second notice, so that was the actual notice that yes, your benefits effective January 1st of 2024 will be full scope. And then again, the third notice was that managed care enrollment notice. And then again, if clients did not select a managed care plan by February 1st, then they were auto-enrolled so that they could continue to use those services. And just a couple of ways that we have for clients to apply for Medi-Cal. So they can apply either on coveredca.com. That's the Covered California that we receive referrals from them. But they can also, again, depending on immigration status, choose a Covered California health plan depending on their income. And they can also apply directly at benefitscal.com. We just switched computer systems, so we're excited. So we're pushing that a little bit. It's a little bit more seamless, but they can also apply on Covered California if they like. They can also apply by phone. Covered California helpline is here, or SF Benefits Net, the 855, and that's from 8 a.m. to 5 p.m. And they can also come into our offices at 1440 Harrison Street or 1235 Mission Street, Monday through Friday, 8 to 5. And just a quick word to the wise, if possible, I would not suggest coming on Monday or later in the day. Usually Mondays are just a little bit crazy. So if they could apply maybe from Tuesday to Friday and get there as early as possible, that's probably going to save them some waiting. And they can also apply via mail, PO Box 7988, San Francisco, or through Covered California again. And then now we just have some resources. So ACWGL, this is kind of the policy heavy if you'd like to look at that. I have some examples of the adult expansion information and notices, the FAQ, and the MCP, so that's the managed care plan choice notice. And then I also have, I think Benjamin beat me to it, but we do have the HHS public charge guides and the Get Your Community Covered. I'm actually going to drop the community partner resources. This is something I don't have on this slide. I just dropped it in the chat. And in particular, I just like to flag the Medi-Cal resources, application information for immigrants. And so that's from November 2023. And we also have some public charge resources on there as well. And then the other one I spoke about really quickly is Get Your Community Covered. So this is from DHCS, and I just dropped that in the chat as well. And this just has, I don't know if I can get this over here. So this is just a really great resource, I think. in terms of adult expansion, and also another policy topic that we have that also started January 1st of 2024, and that's asset elimination. But as you can see, we have adult expansion messaging in multiple languages. And so you can collapse these as well if you say, you know, if your main languages are, I don't know, let's say Spanish and Chinese, then you can basically collapse everything else so that you can quickly kind of get to Spanish and then Chinese. So that's just a really good resource that I wanted to flag to y'all. And then other than that, I think that's about all that I have. Let me see, refer back to some of the questions now. Give me just 1 second. Okay. Okay, so let me see. So I think the first one on my end is, given what's happened with DACA folks, was there anything put in place to ensure the collecting of immigration status for immigrants? Any of these benefits in Cali would never be used against them. For that, I would need to refer you maybe to one of the other panelists. My main focus is Medi-Cal and the expansion. So again, it's and some of the other panelists kind of hit on this, that, you know, it's great news, but again, definitely consult with attorneys as needed before you have families access these benefits. And then the next one, do all undocumented folks get restricted scope? Not yeah, so like I said, no. So Kimberly, yep. So and I think I had that. I should have had a slide about it, but yeah, so we had a couple of different expansions throughout the years. So we had it was SB 75, I believe. Let me just grab my notes. So yeah, so we had SB 75, and that was May of 2016. And that granted full scope benefits to everyone under 19 years of age. Oh, okay. And I see somebody else chimed in, but yeah, so we had SB 75, and then we had the young adult expansion in January of 2020. And then we had the older adult expansion. So that was anyone 50 years of age or older. And that was in May 1st of 2022. And then finally, again, we have the adult expansion January of this year between the ages of 27 to 49. So, and then I believe that's it. I'll send it back to you, Ara. Thank you.
Wonderful. Thank you so much. We will go ahead and finish off here with Alejandra Plata Zuniga, Lead Navigator and Community Health Worker, Find Connect Program, UCSF Benioff Children's Hospital, Oakland. Welcome, Alejandra.
Thank you, Aura. Hey, everyone. My name is Alejandra. I am currently the Lead Navigator / Patient Navigator for the Find Connect Program here at Benioff Children's Hospital, Oakland. I screen families between the children of who have children between the ages of 0 to 12 years old for basic social needs. And my goal is to connect them to community resources and provide ongoing support. And I'm happy to be here. So today I'll be touching base on how I support families who are currently applying for services. As a navigator, I follow 5 principles that serve as a framework to reduce the likelihood of re-traumatizing families. One of the essential components, it is creating a safe space in which everyone from parent to children and youth feels welcome. Empathy and motivational interview are critical, important tools in establishing the safe environment, really allowing families to be vulnerable. It is a challenging topic and services that they are willing to apply for. And so really acknowledging that, and also providing choices, right? And allowing families to have control of the route that they want to take. Even though we know that they will qualify for the services, families really don't feel comfortable or afraid or, applying for this type of services. So really building on trust, and trust does take time, as we all know. So it is really important to really allow families to take their time, and really really set boundaries and clarity of what the service is expected with the program. Really helps families build that trust. And again, trust does take time, and we really take our times to assist families and really meet them where they are at. And really showing them that collaboration is really important. So always working as a team, keeping each other on the loop, really demonstrating that even in a clinical setting, we are currently all working as a team. And there is communication. I feel like a lot of times this really empowers the relationship that as a navigator I will have with the families, and really gives them the skills to provide foundation for families to fall back in if they need to stop receiving services from us. Trauma-informed care does go in hand with culture humility. As a navigator, it is important to enter each room with the intention of honoring the family's beliefs, customs, values, and never really forcing the families to do something or pursue with something that they don't feel comfortable doing. It is important to be open-minded and really showing empathy and compassion. Recently, I had a newcomer family who was afraid to apply for Medi-Cal. It took us about 6 months for the family to finally apply for services. Initially, mom expressed concerns around their immigration status and really was afraid that if she applied for services, she would get deported, or that it was going to affect her in her case in the long run. Even though I provided the public fact sheet, she still didn't feel comfortable. And that was our initial conversation. It really took us 3 follow-up visits for the family to finally feel comfortable applying for services. And it was a lot of trust and reassuring, and that really did took a lot of time. A lot of the times I did have to sit with the family and even share my own personal experience, like immigrating here. And that right after I had that conversation with the mom, I felt like mom felt very comfortable and was willing to really apply for the services. It is a very challenging time, and mom did express that. So it was a challenging process, but we definitely got through the application, and I offer different resources. I offer either me helping the family apply online for the service, or also directing them to a screening site on a community health clinic, and mom was first, mom wanted to apply on her own. And I knew that was going to be a challenge. But again, I didn't want to be, I didn't want to push her to do anything that she didn't want to do. And mom then came back and said, no, like, I really want you to like help me and fill out this application. I'd rather do it in paper. So we did the application in paper form. It took us about an hour and a half to fill out. And then mom came back again 2 weeks later and said, hey, Alejandra, like, I don't want to go on this route. I feel like I'm very scared. I'm afraid. I don't really know what type of documents I should be showing. And so I directed her to a community clinic, to La Clínica La Raza. And I explained, I called with her, I made that appointment. We obtained all of the documents that she needed to present. We gather them. I helped her understand Medi-Cal and the process of the medical clerk was going to be assisting her with. So she knew what she was getting herself into and what she was stepping into. That really helped mom pursue with the process. And we did a lot of close follow-up. It was following up with her and saying, hey, mom, have you gotten an update from Medi-Cal? And she would say, no, it's been past 40 days. It's been it's been 3 months now, and I still haven't heard from them. And so really calling with her and asking for that update, that we really built that relationship. And now mom is, she's also open to like ask further questions. So she wanted to like start employment. She wanted to start doing English classes, and it really just allows us to have a really great relationship where mom feels comfortable coming to me, texting me, or calling me and saying, hey, Alejandra, can you help me with this? And if it wasn't for that conversation that I had with her and providing my own personal experience, I feel like mom wouldn't be as open as she was towards the end of our service with her. And again, it is, as a navigator, one of the things that I really enjoy doing is that we are really able to sit down with the families and really meet them where they are at. It did take time, but we do have the patience to do that. And I know not every clinical setting has that, but we here at primary care are just very lucky to have and provide those services to families. We do a lot of collaboration with social services as well. And so we're monitoring and we're showing that we are a collaborative team, and that really just allows families to trust us. And so, yeah, this is the type of framework that I do, and these are some of the resources that I like to show our families when they are arriving to our clinic for the first time. So the first handout is a handout that I created with Alameda County Social Services information, a lot of school district information, and also in the back of the handout, you'll have access to like immigration lawyers and also support groups or programs that the families could definitely take advantage of. And then the second handout is the handout that I've also created with information of all the screening sites that offer assistance with applications for Medi-Cal, Health Pack, or Power California. And those sites I really love to really present it to the families, just because they go through the whole process with them. They're pros on this topic, and so they are really able to guide the families through the whole process. And they also are able to establish care with them. And so a lot of our families don't have a PCP. And so I really like to refer them to these clinics, is because they could start establishing care through them. And that's it for me. Thank you so much.
Thank you, Alejandra. We appreciate all the great information and resources and sharing that story, tying things together. So we'd really like to open the floor up to some questions. And so I just wanted to kind of circle back on some questions that were asked early on. So we're opening these questions up to all the panelists, and a couple of questions. Let's kind of go back. If a person receives emergency Medi-Cal currently, do they need to do anything to get converted to full scope?
I can take that. So no, if they were previously on restricted scope, then they should have transferred to full scope effective January 1st. again, there were a couple of little problems with the computer systems, but in that case, DHCS online benefits for full scope benefits for clients that did not transfer automatically. So the counties are currently working through some of the lists that we got from DHCS to effectuate that change in our systems. And then we will also be sending notices of action to those clients. But again, everyone effective January 1st should be on full scope benefit.
Okay, thank you, Michael. There was another question, but maybe want to clarify on this. What about adults who are older than 49? I think that was during that presentation with Michael.
Yep. So adults older than 49, they were someone help me with my memory. They actually went through expansion. I believe it was May 1st of 2022. That was the older adult expansion. So they should already be on full scope benefits.
Okay, thank you, Michael. And then we just have another question here. What should undocumented families expect when applying to Medi-Cal full scope? From applying to receiving services, what's the timeline, documents needed? Would online or paper apps be better? Is there an information sheet that could help when communicating this to families we serve?
I'll take that too. So there's a couple of different things. So previously I shared that clients can apply either on Covered California or through the site Benefits Cal. And so it's kind of 6 of one, half dozen of the other, to be honest with you. Benefits Cal is a little bit more closely aligned with our computer systems, but we do have, I know I can speak for San Francisco and say that we do have a backlog right now. The good thing about applying on Covered California is that depending on the income and the household composition, things like that, Covered California has now been coded to grant what's called accelerated enrollment, if eligible. So that means that as soon as the client submits the application through Covered California, if they're depending on income, household composition, things like that, then Covered California is coded to grant accelerated enrollment pretty much immediately. And then, so we would get the referral, and then we have 45 days to disposition the case. But again, Covered California has now been updated to grant accelerated enrollment to eligible clients. So that might, so that they can access their benefits faster, if that makes sense. But again, we still need to ask for immigration status, verification of immigration. But the only change is that if the client does not comply with the immigration status, then they would not be downgraded to restricted scope benefits. I think that was it. Was there anything else?
I'm sure there are a couple of more. What about adults over 49 who were previously on Health Pack Medical? Are they automatically full scope, or will they have to apply?
To be honest with you, Health Pack, I'm not sure, is that a county program? If they were previously on full scope Medi-Cal, again, I'm not sure, I'm not familiar with Health Pack, so I can't speak to it. But if they were on restricted scope Medi-Cal and they're over 49 years old, then they should be on full scope Medi-Cal now.
What are the options for parents or individuals who want to apply for benefits for themselves and or their dependent children who are in abusive relationships? In particular, in thinking of parents who are in DP, IPV situations where they don't feel ready to leave their spouse due to financial control and abuse. So they want to apply for benefits for themselves and their children or to facilitate independence, but they don't want to report the abusive spouse involved in the process. It's looking at what are the options for parents. And then someone did answer about Health Pack. It's a Health Pack is an Alameda County program.
Okay, that makes sense. And also too, for clients that are in situations of DV, I'm going to drop a program. It is through the California Secretary of State's office, and it's called Safe at Home. And you can find more information there. I'm not an expert on that, but I know it's available for cases like.
Okay, I have an undocumented mother and as born child to try to include her partner unmarried into Medi-Cal, but since they were not married, they automatically made it a two-person household. Makes too much to qualify for Medi-Cal now that neither mom or child has Medi-Cal. Can she reapply for just her and her son again?
Absolutely. Let me just say, okay, so the thing with that is that for unmarried couples, with the Affordable Care Act expansion, so now households are based on tax filing status, right? So if the mom files and claims the child as a tax dependent, then it would be a household of two. But again, we also had something called asset elimination, which is another program that was effective January 1st. So that opened up some of the non-Magi Medi-Cal programs. So they might want to explore that. But yeah, that's so she can definitely apply. And again, just any retroactive coverage prior to January 1st would have to be restricted, but again, it's full scope effective January 1st.
Okay, thanks, Michael. I wanted to see if there's anyone that has their hands raised up who would like to come off mute and share any other questions. Okay. If not, we'd also like to open up the floor to the participants and share any their experiences they would like to share with folks in this space. So you're welcome to come off mute, or you're welcome to also share in the chat as well. Any hands? I see a hand raised. Margarita, you're welcome to speak.
Thank you. I just had a quick question. I work with primarily newcomer folks who come into the United States. A lot of the times they don't have documentation. And I found that sometimes some folks don't qualify for Medi-Cal. They might make a little too much for their size of their household. I wanted to ask, is there any other type of coverage that they might be eligible for? The family that I'm thinking of specifically doesn't qualify for Covered California. And so they're completely have no health coverage, not even their child. So I just wanted to see if there might be other things out there that I might not know of that I could help get them connected to. Thank you.
Thanks for sharing that question, Margarita. Opening it up to the panelists.
I can try to take this question. Unfortunately, this is a situation that yeah, we hear often. And if they don't qualify for covered California and their income is too high to qualify for Medi-Cal, then one of the remaining options is to pay for health insurance out of pocket. But we do know that's really I'm sorry that's kind of the best answer I'm able to give based off of my knowledge. But I do know that that's one avenue families have taken when they don't qualify for subsidized healthcare or low-income healthcare. For example, I have an undocumented mother who's in that situation, who pays for healthcare out of pocket for her heart condition. But yeah, we're working. Advocates are working to try to expand covered California eligibility to everyone who lives in the state. So I don't know, just hearing that story is just kind of adds to why we're trying to do that. But as of now, I can't think of other programs that they might be eligible for.
Thank you. I really appreciate it.
Yeah.
Ben?
And just to jump into this too, I'm not sure where the family's living. Here in San Francisco, we have something called Healthy SF. And for that, you just need to be a San Francisco resident, uninsured, not eligible for Medi-Cal or Medicare. And the FPL limits, the federal poverty limits for that look like they go up to about 500%. So it might be a good resource if you have any clients. Again, it's only in San Francisco, unfortunately. So, but it's another option.
Thank you. I really appreciate it. Yeah, the family actually lives in the East Bay area. So like Hayward, San Lorenzo, San Leandro areas. Thank you.
And I think there's another question in the chat. Why would someone not qualify for covered California?
Yeah, so I think in that case, someone may be disqualified from California due to their immigration status. So if you're like a U.S. citizen or a qualifying immigrant, for example, like a green card holder or another eligible immigration status, you would be able to apply for covered California. But if you're an undocumented immigrant, that's you may be denied for not having a qualifying immigration status.
Does this new coverage expand? Okay, so there's a couple of questions. How can mother claim child as dependent on taxes if she is not working? And does this new coverage expansion, can it cover previous medical bills that were out of pocket during the emergency coverage for the immigrant individual?
Yeah, so as for the first question, they don't need to file taxes. They would just say that they don't file taxes. And then we would evaluate them based on not what they call non-filer rules. And that's just basically parent for child, siblings, things like that. So they don't need to file taxes. And then as for the second question, let's see. So if they paid out of pocket after January 1st, 2024, yeah, I just do eligibility. So, but I can also drop, there's a payment and billing for DHCS that they should probably contact, again, if it was after January 1st of 2024.
I just want to mention that there are a couple of resources here on the chat. Thank you very much for providing some information. Lauren, in the East Bay, you can use our referral search tool here. So there's a link to find help in East Bay counties. If you want more help, you can sign up for our free legal navigation consult with one of our attorneys. So there's a link there. So I appreciate that. Thank you. Also another great resource, Alejandra posted in the chat. Many of the program have ended due to funding. Catholic Charities of the East Bay is a great resource. And there's a link there in the chat. And then free benefits screening tool you can use with your clients. Thank you, Lauren, for that. Takes about 5 minutes. And here's the link for that. Appreciate all the resources here being shared in the chat. Okay, and then just checking the floor to see if there's any other hands raised. Again, you're welcome to come off mute and share your question with our panelists. Okay. And then checking the chat.
Hi, I'm Debbie.
Oh,
I'm
sure.
I'm reading this chat and I'm just curious about Angelica Ayala. In the last 6 months, our home visitors working closely with parenting. That part, can you say a little bit more about that? I'm just wanting to know.
Yeah, of course. Hey, my name is Angelica Ayala. I'm Senior Program Manager overseeing the Early Head Start and Head Start home-based program. So over the last 6 months, we just noticed a trend in regard with social services and families applying to either food stamps or Medi-Cal, and them going through either some fraudulent issues where their food stamps have been used without their consent, or delays on Medi-Cal paperwork. So I guess as a manager overseeing our large team and over 100 families, my question is just like, what is working? What has worked? How do we better support our families in just informing them about the timeline and what to expect during this process? Because as we shared here, it feels really frustrating for them and for our staff, who we know how dire the circumstances are, and they're not seeing any leeway. And we totally understand it. I mean, social services is also, overworked, and like they said earlier, there's a backlog. And how do we prevent them? So there's the emotional piece of like trusting the social services, and they're like the logical piece, like how do we actually just enroll, what to expect?
Thank you for bringing that up, and thank you, Angelica, for sharing. And just want to open it to our panelists and also those of you in the audience that may also share some or shed some insight on this.
You mind repeating like the short, the main part of the question there? I recognize kind of the concerns and difficulty with the process, but it's just kind of general tips to make that easier for clients.
Yeah, I think so. And just again, I think just knowledge is power. So on both our ends as advocates, as caseworkers, we're also seem sometimes at a loss because we don't know the process. It changes so frequently. And then to hear kind of the defeat on the parents' end around, I submitted this paperwork and it didn't come through, or I got my benefits denied. That's a huge one. What do I do now?
I might lean on my other panelists here who do more direct service work, but and I know this might vary county by county, but I work with a few enrollment sisters across the state who kind of share their experiences and what they've been up to, and I found that where people have been successful is kind of building a channel of communication with their local county office to kind of troubleshoot these cases. And I found that what we've also heard across the board, and this might be relevant to folks here, is just also like language access being one of the main barriers and frustrations for people. I think it's like already frustrating enough to try to understand all of this in English, and that's just such a prevalent problem, is people trying to follow up and not be able to get something timely because an interpreter is not readily available. So I think that's what we like. I don't know, a lot of effort needs to be seems to need to be put into like building that relationship with county offices and getting them to improve the way they like interface with immigrant communities, especially those that don't speak like English or Spanish. I hope that's relevant and speaks to some of your experiences, but yeah, curious what
Most
advice others
definitely.
might have.
Thank you, Benjamin. That's helpful.
Thanks, Ben. Someone had mentioned about any resources in San Mateo County you guys can share.
I have a quick follow-up to that other piece. And I think Lauren Lofton has hand up. I don't know how you want to do this.
Sure. Are you, what is it, Deborah, that you're referring to?
Well, I mean, I think my quick follow-up is that as the economics of this place is, you know, on a slope going down, I think fraud in general, thievery, I mean, all kinds of things are going up, right? So when our very underserved and already marginalized populations are being impacted in this way, I think it's a real thing. I just wanted to say that it's a real thing that needs to be contended with. Like, yeah, that's it.
Thanks, Deborah. Appreciate that. True.
Thank you, appreciate that.
And just to kind of piggyback off that, I know that my main focus is Medi-Cal, but I also know that for CalFresh, our county has just seen like an insane amount of skimming, scamming. So we're actually encouraging clients to get an online account. And there's also now a mobile app. So we're encouraging clients to, they can change their PIN numbers on the mobile app. And so we're encouraging them to change them maybe like a day or two before the start of the month. I know it's another step, but just that's what we're doing here. So
That's really helpful. Thank you, Michael.
So good. Thank you.
Thank you, Michael. And then Lauren had her hand raised.
Hi, thanks. Yeah, I'm Lauren Lofton. I'm a senior attorney at Legal Link. I use the pronouns they, them, and theirs. We provide services to caseworkers in about 10 Bay Area counties. So San Francisco, Alameda, and San Mateo, as three of the ones I've heard referenced today, are included in those counties. We have a referral search tool, which I have shared in the chat, where you can enter your county and then actually any legal topic where your clients may be experiencing a challenge, whether it's benefits, immigration status, and how to apply to or get on the path to status, domestic violence, housing eviction, some of the other things that have come up in the chat as well. We also specifically provide support to caseworkers who are doing case management long-term. So you can sign up for a free legal consultation with our attorneys. You can bring your clients with you. If you need translation, you just let us know in advance. We do have one staff member. We're a small team, so we have one staff member who is a Spanish speaker, and otherwise we have interpretation services available as well. And we're able to help assess them, help you figure out what their next steps might be, how to get them to long-term legal support that might be able to take their case for free and for full scope representation. So I'll drop the website information one more time in the chat, and I'll drop my email in the chat. If anyone has any questions, you're welcome to let me know, but just wanted to make sure you all know that we're a resource for caseworkers that's free, and we're happy to help you all if you're feeling stuck.
Well, thank you so much, Lauren. We really, really appreciate that and appreciate you dropping that in the chat. And And thank you, Deborah and Angelica, as well as opening up this conversation. So appreciate that.
I just want to add on the topic of EBT theft and skimming. That has been trending upwards, as folks have mentioned, and the state is currently undergoing a process to modernize the EBT cards to prevent theft by adding a chip to them, the same way that a lot of our debit and credit cards have chips now. So hoping in the long term that will be less of an issue. But if any community members do, become victims of EBT theft, they should be able to contact the state or the EBT helpline and file a claim for reimbursement. So the federal government does reimburse the state for any EBT theft that occurs, I think, up to 60 days, so like the past 2 months. So if folks can file it timely, there are ways to get your benefits back, especially for folks who really need that money.
Thank you, Ben. Just wanted to open it up to the panelists if there's any other comments or resources they would like to share or remind the audience about. Again, we have shared the link to the materials for today's presentation into the chat. So all the presenters' slides and information and resources are also included in that materials link. So you're welcome to refer to that. Again, there's also resources posted in the chat. You're welcome to also check them out. And any other questions, again, looking towards the audience and seeing if there's any hands raised or any last minute comments that you folks would like to share. We do have a hand raised. Elizette, nice to meet you. You're welcome to share your question.
Hi, yes, this is piggybacking on the question I had earlier about a mom applying. So she had Medi-Cal with her and her son, and she wanted to incorporate her partner into the plan. And then because they were not married, they ended up doing a two-person household of the dad and the child. And now both child and mother don't have Medi-Cal because the father made too much money. And I remember the person who answered the question said that mother can reapply and claim child as I don't know if it was in taxes. I just wanted to follow up on that, like claim child as what, and how long after can she reapply?
Thank you, Elizette, for sharing that question, opening it up to.
So yeah, so it depends. I mean, it depends when she was denied, right? So we have something called a cure period, where if the client disagrees with it, if there's new information, but she wouldn't be applying as a tax filer at all. She would just be applying as a non-filer, right? And so then it would depend on if the child is joint between her and her partner, then I believe so she's not being claimed as a tax dependent by the partner, is that correct?
Correct.
Okay. So yeah, I'm not sure, is this in Alameda County or because I know for San Francisco we would let's see. Yeah, it would be on two different cases because she would be like the head of household for the child, but the partner would still be, if it's a joint child between the both of them and they're both living together, then yeah, unfortunately the partner's income would be counted. but again, if she was denied recently, then she has, I think they just expanded the time that clients have to file for an appeal. So she should look at the back of her notice of action. And there'll be information on there whether or not she's in Alameda or San Francisco or even San Mateo, if that makes sense.
Thank you.
Thank you, Elizabeth, for the question. Thank you, Michael. Any other questions before we close our session for today? Or comments?
I have a quick question. How long after someone is denied can they reapply? I'm thinking of a family who, when mom was working, they didn't qualify for Medi-Cal because they made a little too much. But recently they had lost their job. And so now I'm thinking they might qualify for Medi-Cal since their income has changed. I just wanted to check in how long after they can reapply for Medi-Cal now that their income has changed.
Beginning it up to.
Okay, sorry. Yeah, I'm trying to bring it up on the fly, because I know that DHCS did just come out with expanding some of the flexibilities that we had during the PHE. So they were initially scheduled to sunset May 1st of this year, but they've now been expanded to the end of this year. And I know that the cure period and the time frame to file an appeal was lengthened. I don't have the exact time frame right off the top of my head. But I mean, clients can go in and apply pretty much whenever they want. It's just it would depend on whether they're appealing the first application or they're just starting a whole new application. And so in that case, they would just go ahead and go into either Covered California or Benefits Cal, do a new application, say, hey, I was laid off or whatever the case may be. And then the county would get that referral and act on it from there. So.
Thank you.
Thank you for the question and thank you, Michael. Yeah. So, any other questions? I think, or comments here. Oh, is there an income max cap that an undocumented family can make in order to apply for full scope Medi-Cal?
Yep. So the FPL limit for adults is 138% of FPL. And so again, that's based on the household size and the income. The income FPL limits for children go up to, I believe, 266. FPL, and then there's also another program called C-CHIP, which is, I believe, I'm not sure if Alameda County is in that. I think it's just San Mateo and San Francisco, but that even goes up to well over, I think, 300% of FPL. But again, for adults, it's 138%.
And then we just posted a income handout, a link to the income handout. So you're welcome to refer to that as well. Okay. All right. So thank you all for all the interesting questions and for all the resources being shared today from our panels and also from our participants in this training. So we do greatly appreciate that. And just want to thank Aura Aparicio from Center of Excellence for this collaborative opportunity, and for all our panelists, Anna, Ben, Michael, and Alejandra for the sharing of information, resources in the community. And again, I want to thank you all for joining us today, for all the engaging conversations and all the resources. Again, we've posted a link in the chat to all the materials shared out in today's presentation. And also you'll be receiving an evaluation for today's training. So we do appreciate the feedback. Thank you again, everyone, for joining us today.